Did you know that there are several different types of provider who could be at your birth? Meaning there could be an OBGYN, there could be a midwife, and there's several different types of these providers as well. So I'm going to break down what these different providers are and the settings that they work in, and so you can better determine who you want to be at your birth as your medical support people. So the first type of provider is going to be the most medically involved. So this would be a maternal fetal medicine specialist or a perinatologist. Sometimes they could be called, depending on your hospital system. They work exclusively in a hospital and they're trained in very high risk, very usually rare types of birth. Congenital abnormalities and that sort of thing would be their specialty. Or if you have a sort of condition that would require more management medically, they would be the type of provider you would go to. Usually people aren't selecting these types of providers. Usually they're referred to them because their pregnancy and their baby might require this level of care. Then we have OBGYNs. They are surgeons. They are trained in cesarean sections. And they also can attend vaginal births. They're very common they're only at hospitals usually. There are a few cases where there are OBGYNs who practice outside of hospital settings, but it is more common that you find them in a hospital setting. They manage all types of birth. They can manage higher risk births, not as high level as maternal fetal medicine specialists, but they are trained in different levels of birth, and they do attend low risk birth as well. Within that, someone who might have a doctorate in tender birth would also be a family medicine doctor. They have an MD or a DO also, and they are not as common at births anymore in the area I live. They still attend births, but not every single state still has family medicine providers attend your birth. But they're very similar in some ways to an OBGYN. Usually they are not trained in cesarean sections and they only attend low risk births, which might be more similar to a certified nurse midwife. So then we have certified nurse midwives who they are nurses who get their master's degree in nursing specific to midwifery, and they attend low risk births. They typically practice in a hospital setting, but they also can practice out of hospital as well in a community birth center, in an unattached birth center or home birth situation. You could find a CNM. They, again, are trained in low risk birth, so they are managing you as long as there are no major complications with you or with baby. And then we have a CPM or certified professional midwife, also might have a licensed midwife credential on there too. They are trained in community birth or out of hospital birth, so you will not find them in a hospital setting. They might attend home births, they might attend a community birth center for births. And again, they are trained in low risk births, so if there are any sort of complications, they would refer out to a provider at a hospital or a different level provider to get you the care that you would need. But they are fully trained medical professionals. They have gone to school and learned about midwifery and also do extensive training in out of hospital birth. And there are also the option to not have a provider at your birth. Some people choose to do a free birth. Highly recommend that you're very educated about this if this is something that you're choosing. Doulas are non-medical support people, so having a doula is not the same as having a medical provider at your birth. In some Amish or Plain communities, it also might be common to have a lay midwife or a woman in the community who is has some maybe like mild training, not fully as in-depth as a midwife, has attended births and knows what to expect to some degree, but not as much medical training as, let's say, a midwife, and they might attend births as well. Hopefully you found this helpful and learned something about the birth system and the options you have for medical support at your birth.